A grave warning from the CDC director as we surpass 100,000 COVID hospitalizations, where things stand on stimulus negotiations, and how to counteract the effects of sitting all day. It's really not that hard. Here's what you need to know. Good morning. This is Cheddar's Need2Know podcast for Thursday, December 3rd. I'm Jill Wagner with Carlo Versano. Hey, Carlo.
Hey, Jill. Good morning. How are you today?
I'm okay. How's it going?
It's going. A lot of news.
All right, let's get to it. The head of the CDC warning that the coming months will be, quote, the most difficult in public health history of this nation. Sure enough, the U.S. is just shy of breaking the daily death toll that record, which was set in April. 2,733 people died from COVID-19 on Wednesday. The record is 2,752 that was set on April 15th. Hospitalizations have surpassed 100,000 for the very first time. The likely surge from infections that were seeded over the Thanksgiving weekend, that's still about a week or two away, and hospitals around the country are already stretched thin. We're going to likely cross 300,000 deaths by Christmas Day. Do want to mention the CDC has revised its quarantine guidance, so that standard 14-day quarantine has now been changed to 7 to 10 days, depending on symptoms and if you can get a negative test result.
Yeah, just think about these numbers for a second. It's just unbelievable. 2,733 souls lost yesterday. 2,501, that's the death toll from D-Day. 2,977, that was the death toll on 9/11. 3,660, that was the number of Americans who died at Antietam during the Civil War, which remains the single bloodiest day in American history, though sadly I don't think that record is going to hold. We're about to have a 9/11's worth of deaths a day in this country, 6 747s crashing every day. I know that that's really crude. Those are very crude comparisons. And they're meant to be because, Jill, you've made this point several times, I think, but it's really hard for us as humans just to fully appreciate, these kinds of numbers when you can't really see the effects on television the way you could on a 9/11 or in a plane crash, for instance. So I think it's just worth remembering these are 2,733 families without a loved one as of just yesterday, and it'll be even more today.
Yeah, it's horrific. And I mean, the visualization that I always go back to is Michigan Stadium, the big house, holds about 107,000 people. So you're talking, that filled to capacity twice over. Now there's warnings that we could hit 450,000 deaths by spring. So what are we talking? 3 or 4 of these stadiums. It's unimaginable. Let's talk a little bit about the vaccines here. Assuming that the FDA authorizes at least one of the COVID vaccines, the plans are to start, they're starting to come together for how it's going to be distributed. President Trump's vaccine czar says that the U.S. should be able to inoculate 100 million people by the end of February. And then he also made a point to say that the side effects are expected to be significantly noticeable in 10 to 15% of the population, but should go away after 36 hours. New York Governor Andrew Cuomo saying the state is expecting the first shipment of 170,000 doses of the Pfizer vaccine to arrive on December 15th.
Those side effects, by the way, nothing crazy. You're talking headaches, chills, fever, pain at the injection site. So it's not like it's nothing that, at least what they're saying is it's nothing that's really remarkable in terms of side effects. I just wanted to sort of make that clear. It's like one of these drugs you see on TV when they talk about the side effects are, your legs fall off and, you drop dead. It's nothing like that. 100 million doses by February, that seems really optimistic to me. It would be absolutely incredible. Let's hope that we're even close to that number of people with this shot.
Is that
by
100
then.
million? Wait, I'm sorry. Is that 100 million doses, or because I have in my script 100 million people, which is different, right? 100 million doses is 50 million people.
He said 100 million people.
Yeah.
That's why it
So
seems
right.
so
So
so.
that's
That's all. Yeah, 200 million doses, right? Um, Here's a hot take. I'm sure nobody will agree with, but I'll throw it out to the crowd anyway. I think we should vaccinate all prisoners in the country before the general public. I think just after the healthcare workers and essential workers get the shot, and nursing home residents and staff, I think prisoners should go next. Prisons, we haven't really talked about this a lot. Prisons have been just absolute death traps, basically, just these huge COVID hotspots. You can't obviously really socially distance in prison. These people are at extreme risk. Our society doesn't really care because they're convicts. Some states are actually doing this. I should note, North Carolina is going to put their prisoners at towards the top of the line. So that's encouraging, I think.
Yeah, I mean, I feel like that's not going to get public support. I'm just going to
Yeah.
throw that out there.
No, of course
But
it won't.
another idea being floated, which does make sense, is to target the vaccine distribution to areas that are hardest hit. So basically determine where the worst hot zones are, where hospitalizations are rising fastest, and just get everybody in those areas vaccinated. So that's another thought. I mean, look, we know right now it's going to be first frontline medical workers, which is by far, I think, the biggest priority, because not only are
Yeah.
they morally, is that right, but we also need them to be healthy to deal with a surge of cases.
Right.
So, it has a double impact. And then nursing home residents, which have 6% of the cases and 40% of the deaths when you think about it. So that's just a really high, a really highly important group. I mean, I would go with then just work down from the elderly, right? Because we know that the virus disproportionately affects elderly. But I don't know. I mean, there's a million ways to do it. It's just like, get it done. I mean,
Yeah.
I almost don't even care as long as just people are getting vaccinated properly.
Yeah, I mean, I think the idea that you mentioned about targeting it to the hot zones, that makes sense too. If for no other reason, to your point, then it would help out the hospital and healthcare workers in those areas who are already so strained. So yeah, I mean, again, I think we said this yesterday, but the idea is going to be here that it's really after the healthcare workers get their shots, it's up to the governors to figure the rest of it out. There's also this question I was just thinking about of how are you going to incentivize people to make sure they get their second shot, right? I don't know. I just thought of this. Is there a worry that some people are going to like get it and then they're either going to forget or they're going to be too busy to get that? Maybe this is not in it. Maybe I'm creating a problem that doesn't exist, which I don't mean to do. It was just something that I was thinking about yesterday.
Well, that's the concern about there being side effects, right? And there, even just the muscle aches and whatever. If that's you, you may say, you know what, I'm not going to get the second shot. I mean, I think you incentivize somebody solely by just saying you'll be vaccinated against the coronavirus. Like, isn't
Right.
that
You'd think that'd
incentive
be enough. Right.
Let's talk a little politics. There's been a little bit of movement on the long-stalled fiscal stimulus negotiations in Washington. So Democratic leaders have endorsed this much slimmer $908 billion bill. It was drafted by a bipartisan group of lawmakers as the basis for continued talks with their Republican counterparts. There is a growing sense that a new relief bill could be tied to a broader spending bill that Congress needs to pass by next Friday in order to avoid a government shutdown.
Yeah, so Schumer and Pelosi are basically saying this $908 billion bill, they're not really endorsing that bill, but they're basically saying like, okay, that's the basis for us to start negotiating in good faith with Mitch McConnell and the Republicans again. So it's something. It's progress. One of the things that Mitch McConnell and the Republicans are demanding is a liability shield for corporations. Basically, this is a way for companies to avoid lawsuits if they were to tell employees to come back to work and those employees then got the coronavirus. This would keep them from suing. I suspect the Democrats will cave and give them that if they can get more money for the other things they want, like testing. But to me, the big thing, Jill, is state and local aid. State houses and city halls around this country are facing deep cuts and probably years of austerity measures right now. Everything from public education to public transportation, all on the chopping block. Just think about it, right? A lot of the tax bases have just been decimated without tourism, office work. workers coming in every day. And this is not really a red state or a blue state issue. It so happens that some blue states are doing the worst, particularly because of the tourism problem. I'm talking about like a state like New York. And the cuts to public service in New York City are really scary. We're talking, the MTA especially, these agencies, these are public services and they need help. And I'm really worried that they're not going to get them. Republicans don't want to do big stimulus for states. So I think the question is, do the Democrats agree to something narrower than what they want, and then go back to the trough more for, more money later when Biden is involved? I think that's probably a mistake. I think that they need to secure that money for states right now, but we'll see. I mean, we're making a little bit of progress. I still think it's unlikely they're going to get anything done in the lame duck, but you never know.
If it's tied, the only hope I think is that it's tied to the spending bill. There's also some talk. Yesterday, we got private payroll numbers for last month in terms of job growth in the private sector, and it was extremely disappointing. It was about 300,000, which was much less than expected. There is some thinking that if on Friday, tomorrow, we are going to get the jobs number for November, and it might be horrible. It might there are some economists who think it's possible we might actually have negative growth, or just basically, a number so small in terms of job growth that it's a wash. That perhaps a number
That's
like
the kick in the butt.
might say to lawmakers, look, this is real, right? This is a real problem for Americans right now, despite what you're seeing on Wall Street. So who knows? Switching gears, by the way, the Rockefeller Center Christmas tree is lit, and it's not the only one. Christmas tree farms around the country are reporting high demand, unusually high for so early in the season, as families are looking for an excuse to get out of the house and do something outdoors and festive. And it isn't just the farms. Independent stores, big retailers like Lowe's and Home Depot, banking on high demand for trees and holiday decorations this year, given that the home decor segment of the economy has been so strong. Not only that, apparently, Carlo, people are much more preferring real trees as opposed to fake Christmas trees this year. I guess the idea being that, people are going to be less likely to travel, so they'll be home and they can clean and take care of it.
Yeah, well, never trust somebody who has a fake Christmas tree in their house. No, I'm just kidding. I shouldn't say that, 'cause I'm sure we have listeners.
I don't know.
Yes, Jill, it is. The median price of a Christmas tree is expected to be up 7% to $81 this year. I just wanted to mention that. But what you said about the home decor segment is actually really interesting. It's one of the parts of the economy that has just been on fire. And again, it makes sense, right? People are home. They're looking for things to, make their houses nicer, invest in their homes. They're not traveling. So I think we will see that during the Christmas season as well. But we're going to get our tree this weekend. It is my favorite annual tradition of trying to haggle with the Christmas tree guys on the street and then giving up because they almost never make a deal. And then I get angry, and then I end up just paying for it. And then my wife will tell you I complain the whole season. I can't believe that tree cost $90. I could have got it for $80. But ho, 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 Merry Christmas.
Let it go, Carlo. Let it go. I look, and as a Jewish person, it's my one thing I'm a little jealous of. I'd love to have a Christmas tree and decorate it. They're just so festive and pretty.
I'll get one. Why not?
Too confusing.
That's true. Alex will be like, "What's going on here?
What is happening?" Oh, we watched a Peppa Pig episode yesterday with a Christmas tree. And she's like, Christmas, Christmas. And it's like, when do I break it to her that that's not our holiday? No. I think I'll just let her enjoy. I'm not going to ruin Peppa Pig for her. Okay, on to the shipping wars. Walmart has dropped its $35 minimum for online orders to get free same-day or two-day shipping, but only if you're a member of Walmart Plus, the world's largest physical retailer, has been moving more aggressively to take on Amazon. So Walmart Plus launched in September. It costs $98 a year, and the company has still not said how many subscribers it has. So it's basically now just the same service as Amazon Prime.
Yeah, that's essentially that. Yeah, I mean, basically, this is, now you can buy a toothbrush from Walmart and it'll be shipped by plane or truck or whatever in a big cardboard box and, do more damage to the environment. But Amazon, you can already do that on Amazon, so I'm not exactly sure why you would choose uh, Walmart. But yeah, I mean, Amazon is sort of trying to become more of a physical retailer. Walmart's trying to become more of a e-commerce retailer. It's all eventually going to turn into like one thing, right?
So Nora Ali, who is a reporter at Cheddar, and she's kind of a retail expert. She made a really good point yesterday about this. And she's saying, the problem with Walmart trying to do this and to compete with Amazon is that Amazon is able to ship and sell things on Amazon on its retail site at a loss, right? They're not making money on that $2 toothbrush because it costs them more to ship it. And they can do that because they have a lot of other sources of revenue, right? So they have Amazon Cloud Services, they have now Amazon Prime, they're getting into delivering prescriptions. So they're a really diversified company. Cloud services, which is something most people do not even, AWS, most people do not even associate it with Amazon, is like the driver of most of their profits if you look at their earnings report. Okay. Walmart doesn't really have that. Walmart is a traditional, for lack of a better word, it's a big box retailer. That's their money, right? They were sort of thinking about getting into streaming. Remember, they were thinking of buying TikTok. Like they had, for whatever strategies they've had, at the end of the day, they're a regular retailer. So for them to say, okay, we're going to do free one-day shipping on an item that costs $10, they're going to take a loss on that.
Yeah. Yeah, I think it's just, we were talking about Tony Hsieh, the late founder of Zappos the other day. He was really one of the guys to pioneer this idea that like free shipping is what people want, and it's gotten to the point now where people assume it, right? I mean, when I'm buying something online, I now, if it doesn't ship for free, I will reconsider that purchase. It's almost like I expect it as a consumer, which isn't really fair. I mean, because there are costs involved in shipping something, but it's fascinating, and that's all Amazon's doing.
Right now, and I bought for this holiday season, I bought a bunch of personalized gifts for kids, my nieces, nephews, and I bought them from like mom and pop shops, right? Just regular small businesses that I found on social media and through friends. And I felt good about the purchases, but the shipping costs are crazy. And I'm not complaining about it because it's just like, I want to support regular people and I don't want to support a big corporation. But I was kind of like, that hurts.
Yeah, it hurts.
Many of us have been more sedentary than usual this year for obvious reasons, but some new research published in the British Journal of Medicine suggests that the amount of exercise that we need to counteract the effects of so much sedentary behavior really isn't that much at all. The study compiled data from tens of thousands of people who wore fitness trackers and found that just about 30 to 40 minutes a day of moderate exercise, think taking a brisk walk, is actually the sweet spot for people who spend most of their days sitting.
Yeah, and this was a big study, thousands and tens of thousands of people, and they all wore these fitness trackers, so the data is really good. It also found that even if that feels too onerous, 30, 35 minutes of physical activity, the study suggests even as little as 11 minutes a day of just moderate activity can have an impact if you spend your day, sitting in front of a computer. Which I should take into. I should really take this. Have you looked at your step counter lately? Do you do that? The one on the iPhone?
I have because we did a contest last month with Cheddar workers.
Oh,
it was
right.
who
You
can
tried to
walk
get me
the
to do
most,
this.
and I thought you were going to do it and we could have fun with it on the podcast, but you just were not interested at all. Like you pretended you were interested and then you didn't even sign up for it. I just didn't even bother you with it. But so I'm thinking, I take walks in the afternoon with my daughter. I was so far behind where I was, I think, in like the bottom 15%. It was just so depressing.
I looked at when I was writing the story yesterday. I looked at the one on my iPhone. It said it's almost like obnoxious how it speaks to you. It says like you're walking much less this year than you did last year. Like oh really? Thanks iPhone. Like no kidding. I'm not going anywhere. Make me feel worse about myself. Why don't you? I think if I could go back in time to February, in addition to buying Zoom stock, I would have ordered one of those fancy office chairs. That would have been my big splurge for this year, because it is true, the sitting situation is not good if you're working from home all day. I also read, Jill, I thought you'd find this interesting. And I forget where I'm reading this. I'm forgetting where I can source this from. But people who work in shoe stores and foot doctors have been saying that they're noticing that people's feet have actually been getting flatter and wider this year, because people aren't wearing dress shoes and women aren't wearing heels that sort of like, bind their feet a certain way. Isn't that interesting? It's like, we're sort of like evolving in real time because of this pandemic.
Wow, that is really fascinating, actually.
Right? There's going to be so many
and this is
weird long-term like effects from this year. It's going to be so interesting to see.
It's basically the social impacts are going to be huge too. It's like, I think we're going to find that people have totally forgotten how to communicate in person without a mask. That it's just like we're going to just the awkwardness when we first go back to the office or have drinks or whatever.
Yeah.
Oh, what did you do over the weekend? Like, it'll be even more awkward than it already is when you're trying to have small talk in the elevator. Okay, a perfect segue, though, at least for the working out. I posted yesterday on our podcast, I was mentioning that I feel now like I'm officially old because I listen to podcasts when I go for runs or walks instead of music. And then a couple of people reached out to me on social media and were like, me too. I do the same. It's, so funny. I feel old too. So I asked the question of the day, what do you listen to when you are working out? Music or podcasts? Carlo, any guesses on what the answers were?
I have to assume that most people are listening to like rap or rock music or like pop music, right?
80% said music, 20% said podcasts. Because someone wrote in and said he listens to audiobooks, which also makes a lot of sense. But I think it's why I'm having trouble crossing the 2-mile threshold, which in a previous life of mine would have seemed like not a very far distance.
Right.
I think it's because maybe I need some motivation from good music.
Yeah, you need some pump up jams. Back when I used to work out, which was a lifetime ago. Yeah, I would have like a really good like workout mix. I couldn't do a podcast, but hey, to each their own.
Okay, so I think our next question for the day is favorite. Write in, let us know favorite workout song. We need some good workout music,
like
or just let us know. That way we could pump it up when we go for our brisk walks, which is basically where we are at this point.
Or 11-minute
all right,
brisk
everybody.
walks. Yep.
Yes, that's what you need to know for Thursday, December 3rd.
All right, guys. See you tomorrow.